Thank you so much for joining us for this very important discussion today on the intersection between housing and health. This committee will examine the relationship between societal factors such as where you're born, live, work, play, go to school, and age, and how they impact one's health, one's quality of life, and risk factors.
I like to say that there's no medicine as powerful as housing. As soon as people lose their housing, everything else falls apart, and really there's so little that we can do in the healthcare system that comes anywhere near the impact of housing someone.
Some of the policies that were created in the past have had a significant detrimental impact on people's health today. So when we look at the health crisis like diabetes, obesity, COPD in certain areas, asthma, other respiratory illnesses in certain areas with high issues of environmental pollutants, long trips to schools or where they actually work, those had a direct result of where those people's homes or their houses or their apartments were placed. We will also discuss the challenges that keep certain groups in certain areas. And we'll discuss the issue of homelessness, but from a health perspective, and also touch on things that groups and this state are doing to combat the negative impacts that housing policies have had on the health of California residents.
There is no medicine as powerful as housing, and that when our neighbors are housed, we all win. It's for all of our benefits, and so we really need to devote the resources needed to solve this crisis.
We talk a lot about the housing crisis here in California, and we're talking about how we can build more homes, and when we're in the process of having those policy discussions, we need to make sure that when we're talking about building and where we're going to build, that we're building in places that will not continue to perpetuate a lot of the health disparities that we've seen today and in the past.